Hello. Hello.
Uh,
Can I share my PPT?
yeah, please share. Please share. People have joined. I will ask
Yes.
other people also personally. They will join.
Yes. Yes.
And
You
take
have
40
to.
minutes only. Uh,
Okay. Okay. I will take it fast.
and question and
Just.
answer we will do in the group, WhatsApp group.
Okay. 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 No problem.
Thank you so much.
You have to able the participant screen sharing, please.
I have done it. Multiple.
Okay.
Acha, acha, हाँ. Just check now.
Okay. Yes.
Yeah.
Can I start?
Of course.
You
Yes.
can start,
So
ma'am.
as I
Please go ahead.
yes, yes, thank you. So to avoid the hemorrhage, as I told, first of all, proper medical history is important. Then the peri-operative measures. What is meant by peri-operative measures? What we take while operating. Like there should be the proper betadine irrigation. If possible, there is the we can also do the chlorhexidine mouthwash irrigation also. Okay, that avoids the further complications by providing the aseptic field while doing the surgeries. Then if patient comes back with the hemorrhage, his general condition is then rapidly assessed. First of all, we have to monitor the vital signs if there is the hypovolemia is present. Because if suppose there is the major blood loss, there is the possibility of the hypovolemia. That's why it is very much important to check the vitals, means blood pressure, pulse, and temperature. If the generalized oozing from the soft tissues is seen, then we have to apply the digital pressure first, followed by the gauze pack. Okay, this is the very basic procedure that we can perform in our dental clinic. First of all, apply the digital pressure, then apply the gauze pack. If in your clinic tannic acid powder is available, that is also you can use to control the bleeding, and then followed by the sutures. As I told, suturing is the thing that you have to master to improve your surgical work. So sutures may be also placed across the socket. Then if it's available, whiteheads varnish or ribbon gauze or absorbable hemostatic agents like gelatin sponge, Surgicel, like in common language we call it as a Abgel, usually in our clinics. That also you can place. If at all bone wax is available at your clinic, that also you can place. And suppose if large vessel is involved in the bleeding, then vessel ligation is very much important. For that, you have to call the expert only for vessel ligations. With their expertise, they will perform the ligation procedure. Then patient should receive the supportive treatment like warmth, administration of fluids by oral also, as well as IV also you can give intravenous. Then drugs to relieve the anxiety and pain, IV administration of the Ringer's lactate, colloids, IV calcium gluconate injections, injections of vitamin K and C. All these are the precautions you can take to manage the hemorrhage. Then second complication is the swelling. Inflammatory edema, it can be minimized by the some aseptic principles. Yeah, we have already discussed that we have to perform the proper sterilization protocol to avoid the swelling or other post-op complication. We should handle the tissue gently while performing the bone cutting procedures. Also, we have to follow the proper protocol like use of coolant, proper irrigation. Then there should be proper toileting of the socket, that is the removal of the necrotic debris. Then application of external hot moist packs for 30 minutes per hours. This is not immediately after the extraction. Please take note of it. Immediately after the extraction, we tell the patient to apply the cold pack. Okay, otherwise, if we apply the hot pack, it will lead into the complications. Then if fluctuation is there, then pus should be drained prior to the institution of the antibiotics. Means if suppose the patient comes with the swelling with the pus, then our first of all we have to drain that pus and then we will start the medications. Then
Doc, which antibiotic would you advise in such a case?
see, while giving the antibiotics, first of all we have to examine that swelling and the cause of the swelling, and accordingly we prescribe the antibiotics. Okay, usually if suppose patient comes to you with the swelling, we can prescribe the augmentin, then metrogyl, all these antibiotics. But suppose the patient is having pus, then first of all we have to send that pus for the pus culture, and according to the microorganism present in that pus we have to change our regimen, otherwise that swelling won't subside. So that's why we have to refer that patient to the proper care, like proper oral surgeons, so that they can take that
Okay.
decision. Yes,
Okay.
because
Thank
prior
you.
that pus culture is very important. Then pressure dressings are also beneficial in limiting the post-operative swellings. Then trauma, we have already discussed. Avoidance of trauma to soft tissue while performing the oral surgery procedures, combined with the meticulous attention to the smoothing of sharp bone edges and socket toilet, it may eliminate the cause of the post-operative pain. Oral antibiotics and analgesics are prescribed to control the acute phase of the condition. Next complication is the trismus. As I have already discussed, while giving the inferior alveolar nerve block, if we by mistake we inject we cause the injury to the medial pterygoid, there can be the trismus. And in such cases, we can in our dental clinics we can prescribe the muscle relaxants to the patient, so that there will be improvement in the mouth opening, as well as you can advise him the mouth opening exercises. And itna karke bhi, if there is no any improvisation, so better refer it to the oral surgeon, so that they can take the further care, further advanced care. Then we have already discussed dislocation of the TMJ. If suppose dislocation of the TMJ happens, then we have to guide that TMJ in the proper position to reduce that dislocation. Okay, so there is one proper protocol. To reduce the dislocation, the operator stands in front of the patient and places his thumbs intraorally on the external oblique ridges lateral to any mandibular molars which are present, and his index finger extraorally under the lower border of the mandible. And you have to apply the downward pressure with the thumbs and upward pressure with the finger. And you have to try to place that TMJ in the proper position to reduce the dislocation. But for that, first of all, you should be very much thorough with the anatomy of the temporomandibular joint. Then only you can place it in the proper position. Then we have already discussed many times sharp bony irregularities that you have to smoothen while performing the extraction only. Delayed healing of wound. Okay, so as we discussed, in diabetic patient, there is the possibility of delayed healing of wound. In such cases, suturing can reduce the healing time of the extraction wounds. Then proper nutrition, fluid and electrolyte balance, minimizing the excessive trauma, removal of foreign bodies like loose bone fragments. Then we have to tell the patient to maintain the proper oral hygiene. Then protection of wound from the mechanical and chemical irritants. All these things will avoid the delayed healing of wound. Oroentral fistula, we have already discussed how it happens, why this happens, and it can lead to the sinusitis. For treating these, there is the surgical method. Okay, like we can use the bone grafts, auricular cartilage, and there is the maxillary sinus lift surgery. So all these surgeries are done by the experts under the general anesthesia. So these are some cases which were published in some journals. somewhere in national journals, some in international journals. I will share in the group. This is the case in which we had managed the orohentral fistula by the Caldwell-Luck approach. So it was the very simple uh, third molar case, upper third molar, but unfortunately that third molar roots had displaced in the maxillary sinus, and we had retrieved it with the Caldwell-Luck approach. I will share all these articles in the group so that you can go through it. Then this is the another case of the oroentral fistula, which was managed by von Rehermann flap. Von Rehermann flap, it is the buccal advancement type of flap. This is the surgical extraction of impacted mandibular canine. See, whenever we are performing any impacted tooth extraction, the foremost important thing is that we have to take care of all the vital structures which are present near to that tooth. Like if we are performing extractions in the lower arch, vital structure is the inferior alveolar nerve. Agar upper mein we are performing, then we have to take care of the maxillary sinus, as well as we have to take care of the tongue and other tissues. That's why the such kind of extractions are little difficult and risky. Then acute osteomyelitis of mandible, osteoradionecrosis. In these cases, we have to, first of all, we have to eliminate the cause. Means there should not be any infection in the oral cavity. And suppose itna karke bhi if osteomyelitis happens, then there are the treatments like incision and drainage, sequestrectomy, saucerization. All these are the surgical procedures. And if suppose it land up in the osteoradionecrosis, then for that there is the different treatment regimen. Like there is the antibiotics, analgesics, as well as there is the hyperbaric oxygen therapy, which is, but obvious it is advised by the experts only. And the surgical treatment sometimes is required, like the segmental resection of the bone. Then abscess ulcer, for that you can treat with the topical anesthetics, corticosteroids, or जैसे I told कि you can prescribe the mucopain gel after the surgery so that it won't land up in any complication. Surgical emphysema, it subsides by itself. Sometimes paresthesia can happen. Paresthesia is the persistent anesthesia. Means the patient feels numb for the some time period after the surgery, and sometime it for the it can remain for some days or for 6 months also. So you have to assure the patient that it will subside by itself, and meanwhile you can start the multivitamins. So overall, the motto of today's topic was, whenever you are going to perform any extractions, you have to tell the patients proper post-operative instructions and to follow them strictly, because avoiding any of the post-operative instructions can lead to complications, and those complications can lead to the major complications. So first and foremost, post-operative instruction is to hold that gauze piece, betadine gauze piece, for 30 to 45 minutes at the proper place, and avoid the to apply the pressure over that extraction socket. This thing we tell the patient to avoid the dislodgement of the socket, dislodgement of the clot which is going to form there. Then second is, do not spit for the 24-hour post extraction. It is very much important, otherwise there will be the dislodgement of the clot. Then we have to tell the patient to take the medications properly. Whatever medications we are going to prescribe, we have to prescribe antibiotic, analgesic, and if required, antacid. Then there should not be use of straws while consuming any cold drink or any fluid, because it can cause the negative pressure in the oral cavity, and it will delay the healing. as well as to take the soft and semi-solid diet at low or warm temperature. Means there should not be any hot diet patient should consume, because it can lead to the vasodilatation and there will be the further bleeding. That's why. Then ice pack should be applied from the outside of the face. After that, there should be water gargles from the next day. Warm, um, lukewarm salt water gargle should be there from the next day. And after 48 hours, we should advise the patient for the mouth opening exercises. Otherwise, this can land up into the limited mouth opening or the trismus. As well as avoid the smoking, tobacco, all these things, alcohol, till the next appointment usually we tell, because the smoking can cause the negative pressure in the oral cavity. Again, same thing, there won't be healing. And this alcohol, tobacco, this can cause the alcohol will cause the delayed wound healing systemically, and tobacco can land up in the local complications because if there is the healing socket in the oral cavity, it's very much important to take care of that socket with the proper mouthwash, proper salt water gargling and all. So for the motto of this topic was that only ki post operative instructions should be followed very much properly, so that there won't be any complications. And suppose if complications happens, so we should be able to handle those. If anybody has any questions, they can ask.
If a patient is going through some radiation,
Yes.
after like how much time can we actually go ahead and do extractions if recommended? Like if the patient needs extractions but the patient had just finished their radiation treatment for cancer, or
Yes.
even for chemo, if they are taking any specific chemo medications, is there any contraindications for the same?
For chemo, there is no contraindication, but in radiotherapy, there can be osteoradionecrosis if you perform the extractions after that. So better to take consent from the oncosurgeon and then only go for the extractions. Because what happens if suppose patient is on the radiation, the patient suffers from the dry mouth. And there is the also many times अपने पास जो patient आते हैं, they usually suffer from the oral cavity का जो भी cancer है, and in that there is the limited mouth opening, क्योंकि many times there is the segmental resection, कुछ part missing रहता है, some half of the mandible is not there, so patient का there is the very much limited access to perform the extraction also. And in that also, if there is the dry mouth, so in that it takes time to administer the local anesthesia also, because patient won't cooperate in such scenarios. So thing is that it's better to take consent from that particular treating oncosurgeon and then only perform the procedures.
Okay. I have one more question,
Yes.
Doc. I'm sorry about that. If a patient is
No, no,
going
no.
through dialysis, I don't remember, I can't recollect right now that after the dialysis, is after 2, 3 days of the dialysis, then if the patient needs any extraction, that's when we can do the extraction, right? Something like that.
See, whatever patient, if such patients are there, whatever serious kind of conditions like dialysis hai, hospital admission hua hai, not only this also, if suppose patient has been admitted for some fever also, like dengue, malaria, whatever, in such patients also, it's better to get all the blood investigations done, followed by the physician consent, and then only perform the extractions. Because many times whenever they means if suppose in past they have suffered, not एकदम पहले वाला past I am not saying, but recently अगर 2-3 दिन पहले या फिर 15 days पहले अगर if patient has suffered from some medical condition, there not possibility, sure shot there is the fluctuations in the vital signs like platelets कम हुए रहते हैं, or anything the vitals में there is the fluctuations. And so better if you are going to perform any surgical extraction, do it under the physician's consent only.
Okay, yeah. Thank you.
Yes, yes. Thank you.
Ma'am, I have one question.
You have
Yes.
finished or still more slides are there? Because we have more.
No, lecture is
Yes, ma'am.
lecture is done.
Actually, naturally it is finished. Okay.
Lecture is done, huh?
Okay, fine. Then we can continue
Yes.
with the questions.
Yes,
Somebody
yes.
has asked in the chat box. Should I read or you will
I will check.
chat
Ma'am,
box?
I have one question.
Yes, yes.
Ma'am, if a lady is 7 or 8 months pregnant and she is having severe pain with a decayed, matlab almost decayed tooth, then what is the most appropriate treatment?
See, in pregnant patient, as all we know, second trimester is the safest. So if 7 or 8 months is pregnant, if she is pregnant, so that it comes in the third trimester. So usually if such type of patient comes, अभी patient को unbearable pain है, so we can't say कि we won't do the treatment in such. अगर patient आपके पास pain में आ रहा है, but it is not recommended to do the treatment in the third trimester and even to prescribe medication also. Okay, so better है in such kind of scenarios we can give the patient, we can send the patient to her treating gynec. That patient is suffering from in such kind of tooth pain, and what medications will be safe to prescribe her. So that gynec will prescribe that medication. Usually plain paracetamol is the safest one, but it's better that gynec will prescribe her, because as a dentist in third trimester we are not allowed to treat any pregnant patient. It's not safe, not allowed. It's not safe, because as all we know, second trimester is the safest.
But what if the patient, like she said, there's excruciating pain and there's absolutely nothing we can
Yeah,
do,
yeah,
and
yeah,
the tooth is
yeah.
completely gone? If she has an infection, if she has the swelling, then we can't ask the patient to keep taking medications either, right? There has to be some treatment done.
Yes, so that's why
Then
you
what do
can
we
write
do?
down, you can refer that patient to her treating gynec and explain, you can write to that gynec that we want to treat that patient, can we proceed? If
But we'll have to only
she
use
gives
plain LA, right? We can't use the.
LA ka, there is no any connection actually. Plain LA or LA with adrenaline, it affects in the hypertensive patients.
Can I add something, ma'am?
Okay.
Yes, yes,
Dr. Manik, you have to first write it down on your prescription. So and so
Mm-hmm.
case is there. Send it with the patient to the gynec. Gynec will give
right,
consent
Yeah.
on paper, written,
yes,
Uh-huh.
and then you have to call a anesthetist for
right,
maintaining the vitals of the patient.
right,
Under his invigilation, you have to do the
Okay.
operation.
yes.
So
So
if
but first
anesthetist
of
is
all that,
there, there is no risk or anything. Like
yeah,
कुछ हो जाता है ना पेशेंट को तो हमें
हाँ.
हॉस्पिटल ले
yes,
जाना पड़ता है ना, तो वो
Yeah.
प्रेग्नेंट पेशेंट में तो कर नहीं सकते, तो इसके लिए
yes,
Mm.
एनेस्थेटिस्ट को वहां रखना है. एनेस्थेटिस्ट विल बी
Yes.
सिटिंग देयर फ्रॉम द वन फर्स्ट मिनट टू द एंड ऑफ द ऑपरेशन एंड ही विल टेक केयर, ही
Yeah,
विल
just to
डू
be on the safe
एवरीथिंग.
side. Yeah.
Yeah, that you can do
yeah. So
that.
first
I have done
treating
already.
yes, yes,
Acha.
treating gynec's consent, written consent is very much important.
Yeah,
First
yeah,
before
yeah. वो तो
proceeding,
है. Mm.
because
Yeah.
otherwise if any complications happen it will come to us, so it's better कि आपके पास कुछ written में है.
Not just the gynec, even the patient's consent, written consent होना
Yeah,
चाहिए कि they. Yeah,
patient
yeah.
consent is mandatory in each and every extraction. Even you are performing grade 3 mobile tooth also na, patient consent is very much important.
I feel with the minute you give LA to a patient for
Hmm.
anything, consent तो चाहिए patient का. यहाँ पे तो मैंने देखा है
हाँ,
कि you don't even know whether the, because sometimes not every patient will know that they are actually having blood pressure problems. Unless and until
yes,
sometimes, you have to take blood pressure for every patient that sits in your chair. But nobody really does that over here. I've not seen, honestly speaking. It should become
Actually,
mandatory.
yes, it should become mandatory. Even patch test with the local anesthetic solution should be also mandatory. बिकॉज सम केसेस हैज बीन रिकॉर्डेड जिसमें पेशेंट को पता नहीं रहता है कि उसको एलर्जी है कि नहीं, बट ऑल ऑफ सडन कुछ
हाँ,
एलर्जिक रिएक्शन दिख जाते हैं. So it's better to take
yeah.
patch test with the local anesthetic solution also.
Maybe you guys can also arrange a lecture like this, similar, or maybe doctor, even you can give on emergency drugs, mandatory drugs
It's
Yeah,
that
yeah,
all
already
sure,
dental clinics.
sure.
it's already there in the list in upcoming year. Local
Yeah,
anesthesia or anesthesia in dentistry, all specialties,
yeah,
and to be presented by
yeah,
oral surgeon only. So
yeah. And the
we'll
drugs that,
request
every
Dr.
general
Ashvini
dentist.
or Dr.
Yes,
Uh-huh.
sir.
One more. There are multiple mentors, so we have that. I have requested one oral surgeon that already, and I will ask Dr. Ashvini also. Definitely.
Yes,
Thanks
sir.
And
for
also
your
That will
all
be
suggestion.
the
there.
emergency drugs that
That
every
is
general dentist needs
separate
to
topic.
keep in the
Yeah, that
clinic.
is
Yeah,
separate
yeah, that's
topic.
what I'm trying to say. Yeah,
Huh.
yeah,
Yes,
that's the one
yes.
I'm trying to tell you.
Dr.
Yeah.
Luke Kare is there. Last time, Dr. Sucheta presented webinar on perio. Her husband,
Uh-huh.
he was there in the presentation. Dr. Luke Kare.
Okay.
He will present. He takes courses for emergency in dentistry.
Okay. Because there's no point in just knowing the drugs. You should also know how to administer them. ऐसा भी
या
है ना?
ओके नहीं
Yeah.
दे
All these things are
सकते
not taught
अभी
in
डॉक्टर
college.
अश्विनी बता सकते हैं कि मैं खुद
Yes,
नहीं देता हूँ एंड मैंने बताया ना आपको
yes,
ये
yes.
आपको एनेस्थेटिस्ट को बुलाना है मैम आप ना मान
Yes,
लीजिए
yes,
चलो
sure.
सपोज इफ अ पेशेंट इज देयर यू आर डूइंग अंडरगोइंग अ सर्जरी और सिंपल एक्सट्रैक्शन व्हेन यू गिव एनेस्थीसिया suppose the patient gets redness all over the body and it has happened and such multiple things happen we don't know कब क्या होगा कौन से पेशेंट के साथ क्या रिएक्शन होता है सो इन दैट केस पेशेंट को हाइड्रोकोर्टिसोन इंजेक्शन देना है इमीडिएटली
Hmm.
एंटी
Yeah.
एलर्जी बट ना
Yeah.
यू आर नॉट ट्रेन्ड या फिर हमें डर लगता है एज ए डेंटिस्ट हमने एक्सपीरियंस नहीं किया रहता
Yeah.
तो इसलिए बेटर है कि एनेस्थेटिस्ट को रखो अगर जैसे अभी मेरे खुद के पापा का ट्रीटमेंट था एक्सट्रैक्शन का तो उनको मल्टीपल इश्यूज है हेल्थ इश्यूज है तो मैंने खुद वैसे फॉलो किया था कि एनेस्थेटिस्ट को रखा था कुछ हुआ नहीं उनकी जरूरत ही नहीं पड़ी बट क्या है बैक ऑफ द माइंड आई वाज लाइक सेफ दैट माय फादर इज इन सेफ हैंड्स कि कुछ हुआ तो एनेस्थेटिस्ट इज देयर क्योंकि फिर हॉस्पिटल नहीं भागना
Yes.
पड़ेगा एंड इट इज वेरी एम्बेरेसिंग अगर हमें हॉस्पिटल जाना पड़ता है तो
Yeah, and in that condition, hospital में जाना is also very risky. If patient is
नाम भी खराब हो
panic
जाता है
and हाँ, clinic का नाम भी खराब हो जाता है. That is also true.
यस
So it's better to be on safer side in such patients. As sir told, कि anesthetist should be ready, and basically that emergency drug kit should be at your clinic. Ready होना चाहिए
Yeah.
and proper condition में होना चाहिए and expired नहीं होना चाहिए. बहुत टाइम क्या
एक्सपायर
होता
नहीं
है हम
होना
लोग
चाहिए हाँ
हाँ
दैट्स द मेन थिंग
एक्सपायर्ड ड्रग्स
नहीं
बहुत
कभी तो
सारे
यूज
होते
हो
हैं.
जाएगा चलेगा चल जाता
हाँ
है ये दिस एटीट्यूड ना वो चेंज होना है यहाँ पे
हाँ प्रॉपरली
हम्म
स्टोर्ड होने चाहिए, फ्रिज में होने चाहिए. एवरीथिंग शुड बी फॉलोड.
तो चलता है एटीट्यूड शुड वैनिश कंप्लीटली
यस,
वरना
राइट. सो
हाइड्रोकोर्टिसोन
दैट
इंजेक्शन देना है तो वो तो मुझे अगर बोला जाए तो मैं दे दूंगा बट जब एड्रेनालिन इंजेक्शन देने की बारी आएगी ना इट्स वेरी लाइक
हम्म
आई विल थिंक ऑफ 100 टाइम्स बिफोर इंजेक्टिंग
या बिकॉज हम लोग को वो ट्रेनिंग नहीं दिया है ना
या
सो
या ओटी
दैट्स व्हाट
ट्रेनिंग
dentists also need to get yeah we also need to be trained in all these things सिर्फ इमरजेंसी ड्रग्स बोल के पता अभी नाइट्रोग्लिसरीन उतना पता है कि चलो सब लिंक्वल डाल दो अगर किसी
या
को
फिर
हार्ट अटैक हो गया तो
बेस्ट है ना डॉक्टर अश्विनी जैसे जो ओरल सर्जन्स है
हम्म.
उनको कॉल करो उन वो लोग करेंगे
या
नहीं अगर पेशेंट सिंकोप में जा रहा है कुछ भी हो रहा है तो वी कांट वेट फॉर अनेस्थेटिस्ट टू कम ना और सर्जन हाँ विल
हम्म.
वेट हमको भी तो आना चाहिए ना इमरजेंसी में क्या करेंगे वी कांट कीप वेटिंग
अच्छा हाँ
और यहाँ में
अदर
इमरजेंसी व्हीकल भी
स्पेशलिटीज में भी हो
आएगी तब
सकता
तक
है
पता नहीं
एंडो
पेशेंट का
करते
क्या
वक्त
हाल
भी हो
होगा
सकता है हाँ
यस,
एंडो
बेसिक
डिलीवरी
नॉलेज.
करते वक्त भी हो सकता है
any anesthesia anytime you give
हाँ,
it even for a filling doesn't matter extraction even for a filling
ट्रू
once the
राइट.
anesthesia is
वेरी ट्रू
administered that's it
या
yes, each and every dentist should have this proper knowledge how to administer the intravenous drugs, then intramuscular drugs, everything. So
हाँ
better is जैसे सर ने बोला, they are going to arrange the lecture. It's very good so that everyone will know about this.
yeah. And if you can
Yes.
arrange locally something about for CPR also, so everyone is CPR
Yeah,
certified.
yeah. CPR is also
Yeah,
very mandatory. Yes,
That
yes.
comes
mandatory है,
under
yeah.
that comes under emergency lecture. CPR is part of it.
हाँ,
During the course,
okay, okay.
they
हाँ
do hands-on of CPR.
हाँ, हैंड्स ऑन होना चाहिए, सिर्फ लेक्चर से नहीं ना।
होता है इमरजेंसी के एक लेक्चर में
हाँ,
होगा। अगर आप इमरजेंसी का हैंड्स ऑन कोर्स अटेंड करेंगे उसमें सीपीआर आपको
Yes.
सिखाएंगे वो
There is one
कंपलसरी
course,
है।
basic life support. Basic
हाँ
life support
बेसिक।
का एक कोर्स
यस।
होता है.
हाँ
Yes.
हाँ,
That is very good course.
वो
आई
बेसिक
थिंक दे
लाइफ
हैव इन
सपोर्ट तो
दे हैव
वो
इन
सबको
भारती।
होता है पुलिस एंड ऑल। और
हाँ,
जो डॉक्टर्स का है
Hmm.
वो इमरजेंसी का होता है। बेसिक लाइफ सपोर्ट तो वो एयरपोर्ट पे होता है। पुलिस ऑफिशियल्स पर्सनल्स को भी देते हैं जिसमें सीपीआर आता है।
हाँ,
तो वो बहुत कॉमन है। और वो
या
इस पे जो बॉडीज रहता है ना उस पे करते हैं ह्यूमन बॉडी पे नहीं करते। आर्टिफिशियल बॉडीज पे
ये
करते
मैनिकन्स होते हैं
dummies.
ना, मैनिकन्स होने चाहिए,
Yes,
डमी
हैं।
yes.
मैनिकन्स,
मैनिकेन्स पे
या
ही होता है। हाँ। यस दे
हाँ, मैनिकन्स पे ही होना चाहिए।
यू योरसेल्फ विल डू इट एंड दे विल
या
गाइड
या आई नो, या आई नीड
and
टू डू वन,
we
आई थिंक
will
दे हैव
organize
वन
the
इन
lectures.
पीपल इन
We are
पुणे।
having
हाँ,
next lecture. Next means not next. Next is some other topic. In upcoming lectures, next oral surgery lecture is live dissection.
ओके।
And after that, as you suggested, till now I have not planned it, but these topics, what you and Dr. Ashvini said, we will keep
हाँ,
in the
Yes,
upcoming
yes.
topics.
Yes, sir. Yes, sir. I will like to take because
हाँ, I will
there is good
ask you,
response
madam.
from the listeners also and उससे बहुत अच्छा लगता है. But many times क्या होता है कि
Hello.
सामने कोई है कि नहीं. Hello.
Yeah.
Yes.
आता क्लिनिक ओपन आहे तुमचं?
Hello. Yes. Many times whenever we are taking the online lectures, सामने कोई है कि नहीं, that we don't come to know. But it's good that the listeners are good, so we also feel good to deliver the lectures.
अरे मैम आपका
या ट्रू,
लेक्चर है ना
योर लेक्चर
इसमें
वाज वेरी गुड डॉक।
काफी इंटरेक्शन
Yes.
हुआ है।
Thank
नहीं
you.
तो बाकी जितने वेबिनार्स होते हैं उसमें कोई भी आंसर्स नहीं करते हैं। आपके इसमें काफी आंसर्स भी आए। डॉक्टर मानिक
So
वाज देयर,
yes,
अदर पीपल वर
yes.
देयर, संचिता, एवरीवन आस्क्ड आल्सो एंड आंसर्ड आल्सो। नहीं तो इतना इंटरेक्टिव
Uh,
होता नहीं है वेबिनार। इंटरेक्टिव वेबिनार इज ऑलवेज इंटरेस्टिंग एंड
yes, and it's fruitful also that we
या
can, we can imply this knowledge in our clinics. So it's very much beneficial for everyone.
yeah, it was wonderful presentation. Thank you so
Yes,
much
sir.
and we will invite you once again.
Doctor, yes, yes, sir. Dr. Kaushal Singh has asked in the chat
हाँ,
box.
yeah, that is remaining. Yes, ma'am.
Can we place hemosponge in every extracted case? So yes, we can use hemosponge, but only thing is that कि हर patient में use करना it's little costly. अगर basic extraction case है, so it's not mandatory कि सब में आप you are placing the hemosponge because but if you want to take utmost care, you can apply the hemosponge. Kaushal Singh, Dr. Kaushal Singh is there. I think he has
And
left.
one thing what I would
No,
also
he's there,
doc,
but he's not.
Huh.
He must have.
what I would, hello.
Yeah.
Yes.
Yeah, it's just a friendly advice I would say to all the doctors over here, not you doctors specifically, but
Mhm.
especially after you do a surgical extraction, just to be on the safe side, that's what I do. I go ahead and take an X-ray just to see if
Right.
we have actually got the whole tooth out, and just to be on the safe
Yes,
side,
yes,
we have
yes.
not left anything. And curettage of the socket is also very, very important that I've seen not too many
Yes.
people do it.
Yes, yes. And after
Yeah.
extraction, every extraction, you have to check that tooth with your fingertip that
Yes.
उसमें से कोई
Yes.
part रहा तो नहीं है. And if you feel like it's
Yeah.
broken, you should
Take
take
an
an X-ray.
X-ray. Yeah, yeah,
Yes.
yeah. सॉकेट को क्यूरेट करके इरिगेट करना,
Yes.
फिर एनी शार्प
Right.
बोनी स्पिक्यूल्स, बोन फाइल
Right.
से फाइल करो, कोई नहीं करता यहाँ पे। आई हैव सीन अ लॉट ऑफ जनरल डेंटिस्ट हु जस्ट एक्सट्रैक्ट हो गया, चलो भेज दो
Hmm.
पेशेंट को। या थोड़ा प्रोटोकॉल फॉलो करना चाहिए।
Yes.
या
So that complications will be avoided.
एग्जैक्टली। वैसे भी डेंटिस्ट और डॉक्टर लोगों को तो यहाँ पे मारहान तो होती रहती है, उससे अच्छा हम लोग वी जस्ट ट्राई
Hmm.
टू प्रोटेक्ट आवरसेल्व्स एंड
Right.
advise, teach each other what to do and what not to do. ब्लड प्रेशर तो इंडिया
Hmm.
में कंपलसरी करना चाहिए, कोई नहीं लेता ब्लड प्रेशर सीरियसली।
You're right, doctor.
या बिकॉज
Any
वाइट
question?
कोट एंजाइटी तो होगी पेशेंट को, एंड यू डोंट नो कि उसका ब्लड प्रेशर तो चेयर पे बैठ के ही पेशेंट का कितना एंजाइटी बढ़ा है। हाउ विल यू नो? पेशेंट विल जस्ट से हाँ आई एम स्केर्ड। उससे अच्छा बी ऑन द सेफ साइड, टेक द ब्लड प्रेशर, यू आर आल्सो सेफ, द पेशेंट आल्सो नोज कि चलो हिज ब्लड प्रेशर वाज गुड।
Right.
We are thinking of a membership also for yearly basis and
हाँ हाँ
increase the quality standards of webinar, providing syllabus, providing email material.
हाँ
So
हाँ।
we are planning for that.
Oh, okay.
I mean, you
That
will,
was a good lecture, doc.
yeah, I will
Thank you.
make a Google survey and send you in the group. You can post your suggestions. Like now you have suggested so many things. So please fill up that, Dr. Mani, and it will be
Okay. Yeah.
good from your side because you have a lot of suggestions. So I will be making a Google
Yeah,
form.
because I also do that. I worked in the US for almost 17 plus years. So we did all that
Oh,
over here. And now that I'm back and I see there are not many things are being done in India. So I'm like, why don't you guys do this? Why don't you guys do that? But यहाँ का अलग practice है, I understand. Everything is different over here. वहाँ पे तो करना पड़ता है because liability issues बहुत है. You just have to be
But
safe.
how come
So
you are back here? Why you should have
parents
stayed
getting
there
old,
only.
parents getting old, parents getting old.
Okay, that's
Nothing
good
else.
thing.
Yeah.
You're a good daughter.
Yep. So I came back. Yep.
So ignore
पैसा
all
तो
these
आज है,
things
कल
actually.
नहीं है, पेरेंट्स गए
Ignore
जाएंगे तो गए ना।
ignore all these people. These people will never change and India will never change. Like the part of India I'm saying, not
या
everyone in India. See, it is not their mistake. It is because of the finance. There is no paying capacity of the patients. That is why they have to
या
do it. It is not their
या
mistake also. Otherwise, there are so many passionate dentists, so many passionate mentors. Now we have attended this webinar. So many people are there who are so passionate and so good to teach and proper techniques and all. So many things are there. Even endo is evolved so much in India, but still people are
या
not doing those things which you said. The reason behind it is same thing, finance. So just ignore it,
फाइनेंशियल
so
या
you will be happy. But you said correctly and very right things.
I mean, this is just, so that each and every doctor, because see, we are all of the same fraternity, right? We have to keep ourselves safe, and whatever I can advise and tell is like taking
Yeah.
consent forms. It's just one paper, right? But
Yeah.
that paper and the patient's signature can have keep you safe, basically.
Yeah.
कि तुमने
And
बताया था
finally,
पेशेंट
thank
को ये
you, Dr. Ashvini.
कॉम्प्लिकेशन
If
है।
this gets ended, because it is almost going to get
yes. Thank you,
ended.
sir.
Thank you, Dr.
Thank you,
Ashwini,
sir.
and we will invite you again. Thank you, Dr. Manik, for your
Thank you.
all the feedback. You are always
Thank
encouraging
you.
and exciting. Thank you so much. Always
Thank
Thank
you,
you.
encouraging.
Thank
everyone.
you.
Yeah.
Yep. Thank you, guys.
Okay.
Thank you.
Happy Sunday. Bye
Yeah.
bye.
You too. Happy Sunday. Bye bye.